Harrison Fleming joins me now, Legislative and Policy Director with Second Street Org, the nonprofit public policy think tank behind this morning's report. Good morning. This is pretty staggering. Can you break down the research for us and your reaction to it?
Yeah, so it is an astounding number when you're looking at more than 15,000 people dying before even getting the health care they need in this country. What's important to note is that this figure doesn't actually include data from Quebec, Newfoundland, Labrador, Saskatchewan, and most of Manitoba. And actually, for the first time in 5 years, it doesn't include information from the government of Alberta either. And so these are the numbers from the provinces that responded to us. If we were actually to look at that data and extrapolate it across the entire country to catch those provinces that didn't respond, we'd actually be looking at a number above 28,000 people.
So the numbers would be higher. Where are the biggest failures in the system?
Well, what we really see across the country is simply wait times that are too long. The Fraser Institute just released a report recently showing the average wait time in Canada is more than 30 weeks for healthcare. Last fall, Second Street did some public opinion researching and found nearly half of Canadians are actually avoiding the healthcare system altogether because of wait times. And so when you're looking at that bottleneck, that real stop in the system that's preventing people from getting care. And it is everything from something as important as a heart surgery or cancer treatment, right up to cataract surgery, hip and knee replacements. Like if you can't get the care you need in time, it's making your life worse, and it can have really terrible consequences.
Did your research look into where in the country this is worse perhaps than others? I mean, if you live in a rural area, is it more difficult to access care than if you're in a big city center?
So yeah, there are certainly regional discrepancies right across Canada, but this problem with wait lists is actually something we're seeing in every province that's responding to us. Whether it's Atlantic Canada, where we do know wait times are a little bit longer, or even in Ontario, one of the largest provinces, the largest province in the country. These challenges that are preventing people from getting healthcare are really actually in every part of our country. And there's no government meaningfully taking action to address these problems. Like there's just not anyone looking at this crisis and saying, we're going to come forward with solutions.
So what will you now do with this research?
Well, I'm really hoping that this is a bit of a clarion call for people to stand up and say that we want to know more. We are, somewhat upset that governments, since we've been doing this report, are actually getting worse at supplying this data, not better. We've been asking them for year after year after year, and now we're not only seeing governments still not track this data, we're actually seeing governments stopping altogether. And so I'm really hoping that seeing numbers this stark, seeing 75,000 people dying before even getting the care they need since 2018, I'm hoping that's a wake-up call for Canadians to start asking governments to start being more transparent about our healthcare system. So then when we understand the scope of this problem, we can start talking about solutions and reforms.
Harrison Fleming, thanks so much for your time with us today. Appreciate it.
Thank you.